The awareness around visual impairment and sickle cell disease remains low, and we need to do a lot more about educating clinicians and patients and the public that you can have visual impairment and sickle cell disease, and also that it's an invisible disability if you've got visual impairment. Vitreous hemorrhage, which is stage 4 in the classic staging of sickle cell retinopathy, whilst it can clear by itself, it can take months, and in that time, it can impact day-to-day activities, as we've had patients describe, and also as we've published on. So I think that lack of awareness and lack of, not necessarily empathy, but the lack of awareness can sometimes lead to lack of empathy because you're not aware that this is impacting the patient that significantly. Another unmet need leads on from that, because then they're probably not signposted to support services like eye clinic liaison officers, like patient charities like the RNIB that provide really needed support for patients or people with visual impairment. And I think lastly is the significant gaps we have in our knowledge of sickle cell retinopathy. What drives it? Why people with HBSC are more likely to have it than people with HBSS and other genotypes? How we predict who's at risk of severe disease or not, or likely to just regress on their own. These gaps mean that many clinicians feel like, oh, it'll get better on its own, so they don't monitor them. They don't offer regular screening, whilst depending on where you live, you might actually have access to that. So these are gaps we are committed to filling through research, through the Sickle Eye Project, and actually many other groups that we collaborate with are working on the same thing. So I'm cautiously optimistic that the future is bright, that whilst right now we still have many gaps, in the next few years, not long from now, we should know more and be able to act on the knowledge that we do have.